So today on the podcast, we're joined by Callie Ihde. Callie is the Director of Innovation at Northwestern Medicine, where she leads the Systems Innovation Hub. And if you're a clinician with a great idea or just a recurring frustration, you're going to want to hear this. So Callie, welcome.
Thank you. Thank you. Thank you for having me.
I wanted to set the stage a little bit and give people an idea of just the sheer scale of Northwestern's medicine system. So it's over 200 locations, including 10 or 11 hospitals throughout Chicago, multiple clinics, outpatient facilities and beyond, and it employs more than 5,400 physicians and countless care teams. And just to give people a little perspective, particularly folks in Ireland, that's about a quarter of the practicing physicians in the Republic of Ireland, according to the statistics from the government there. So Northwestern Medicine is enormous. And you're the Director of Innovation there. What does that actually mean day to day?
Yeah, innovation in Northwestern Medicine is really an enabling department. We want to help our physicians, administrators, everybody within the organization feel comfortable exploring the latest in technology solutions. And so those could come from early stage companies, they could come from well-established, leaders in healthcare or even in technology, but we really want to provide a safe environment for them to evaluate, explore, try out these new technologies and really vet them, build business cases for them and really just see how they can work and be applied every day in healthcare.
And how did you get into that space, Callie? Did you always see yourself in a role like innovation in healthcare?
No, honestly, I didn't. I started my career in healthcare IT, so still in the digital space. I worked for Epic, the big electronic medical record vendor. And while that really kind of built my passion around how technology and healthcare work together, I think after working there and then working for many years at Northwestern Medicine, seeing just the challenges that technology can bring into the environment if it's not done well, if you don't really bake it into workflows, build it into processes, ensure that the technology is working for clinicians, not clinicians working for technology. I saw just how important getting involved early in technology can be and making sure that it's designed with the right inputs, it's developed from the start with expertise and with process in mind and workflows and just the everyday at the forefront. And so coming out of the pandemic when we really recognized that innovation is so important to the transformation that is needed in the United States for healthcare, I was happy to be, selected as, a leader in this area to help the organization really figure out how do we make sure we have this environment to safely explore technology, but then more realistically, how do we make sure that the technology we do find that is effective can be brought to our clinicians, can be used every day in the organization and really be embedded into what we do.
And who are you working with most often? Is it like startups or internal staff or physicians with an idea? How does that work?
It really is all of the above. I would say maybe two-thirds of the work that we do is with outside partners, whether they are early stage startups or big tech companies with a new product. I would say it's a mix there of whether they're early stage or more well-established partners that we already have, but are just bringing new solutions to us. But I would say that other third of our time is really spent with internal innovators, folks with an idea, partnered with our information technology experts who are the data scientists, are the software developers who kind of bring those ideas to fruition. And really that's a lot of the excitement that happens, within our organization because we do have the capabilities to create as well and to really bring those ideas forward.
And so say I'm a doctor or nurse on the floor, Callie, and I've got a great idea or maybe just a recurring pain point. What do I do or where do I start?
Yeah, we really have a couple different ways. At any given point, folks can reach out. We have an internal website, we have an external website, we have email addresses, innovation@nm.org. We have competitions that we host throughout the year where we really campaign for folks to bring challenges forward, things that they really wish technology could help them solve. And so we try to engage our workforce in as many different ways as possible and be available through as many different venues as we can because we don't want accessing us to be the reason somebody doesn't bring a challenge forward or doesn't bring an idea forward. And so we really do try to be as available as we can be.
And do people need to have a full solution mapped out, or do you hear from people who just have a, I just know this could be better stage?
Yeah. Honestly, it's better if you bring us problems. With technology changing every day, especially with AI these days, it's not everyone's responsibility to know what's available, what the capabilities are, what's even possible. And so we have folks who are the experts in what technology can do, both with the technology we have today and what's possible with the technology that's coming. And so we love when people just bring us really meaty problems that are out there, and then we can kind of find the right solution for it. Either way, whether it's just, the solution or the idea, having the problem really clearly defined is always going to be the starting point.
And how do you decide from there which ideas are worth piloting, or which problems are worth pursuing?
Yeah. It's really about impact. How can this help the organization? As you mentioned, we're quite large. And so the bigger the impact, naturally, the higher priority it's going to be. And so just in a resource constrained environment, we do have to prioritize the things that are going to have a bigger impact that are aligned to our organization's biggest priorities and the areas we're really trying to focus on. And so we do align them to our long-term strategy. We align them to the priorities that our physician leaders, our nursing leaders, our executive teams are focused on. So there is a little bit of vetting in that. But if it's a problem that the organization is facing, has wide impact, and is something that we know technology can solve, then we're often going to try to do so.
So if an idea makes it past those first few conversations, like what happens next? What's the process logistically from idea to pilot?
Yeah, and so we really worked through the measurement of the problem, understanding the full scope and scale, and then really diving into what the solution would look like. And so, again, if it's technology, we bring in the architects of that technology. If it's, AI, we'll bring in the data scientists and others who know what AI can do. If it's more of a software solution, we'll bring in our software development teams as well, and they'll collaborate with a physician, with the physician's team, because so often these solutions aren't just going to impact one member of the care team, it's everybody. So we want all of those inputs to understand truly the breadth of the challenge, and then what does a solution need to be able to do to solve it. And so it's often not one function that tool needs to be able to solve to, but many. And so really outlining all of those requirements, as we call them in tech, that the solution needs to be able to solve, to determining how we're going to solve each of them. What does that full solution workflow and process look like in the end so that it's usable? And we do that through an iterative process. So it's often, mocking something up, some sort of a prototype up, getting feedback, iterating on it, working through that, ensuring that while we're doing that, we're also ensuring it's safe, privacy focused, all of the good things that make, our organization one that patients want to come to. So making sure that it's usable, it's safe, it's protected. And really it's an iterative process, keeping the original folks who brought the problem forward involved as we go.
And from a resourcing perspective, if I bring you an idea, do I find my own funding to test it? Is that something the Innovation Hub helps with? How does that work?
Yeah. And that's where we assist with that. And so depending ultimately on the resources that are needed. So if we have, let's say it's one of our existing vendors that can help solve for this and we just need to tweak something, we've got the internal resources, I've got funding available to do that. If we're going to create a net new product, a net new solution, often takes a bit more funding. Fortunately, again, we've got internal resources that can do it. And so funding, is less of a concern up front because we can design and develop and create without a whole lot of additional capital. It's just allocating those existing team member resources to this project. If we are looking at creating a solution that will ultimately be commercialized, so this could be spun out as a product, whether it's as a startup company or licensed to one of our partners to get out into the industry. There are also pathways downstream so that the originator of the idea gets benefit from that as well. So we have intellectual property policies that help govern that. And so, at the end of the day, part of my role and part of our institute's role is to help ensure that resourcing isn't the challenge either to get an idea off the ground. And we have mechanisms for funding both within Northwestern Medicine, but also within our broader network of partners who can assist with getting that as well.
And what sort of volume are we talking about, Callie? Like in a year at the Innovation Hub, like how many ideas come to you? How many get to a pilot stage? How many get funded? What's the sort of numbers there?
Yeah, I would say, hundreds of ideas come to us any given year. I would say again, both external, vendor offered solutions as well as internal ideas coming forward. I would say of those, somewhere in the 20 to 50 get, kind of pursued. I would say of those, closer 10 to 20 are actually successful and go on to be used across the organization. So it's a pretty rigorous vetting process, all based around, again, that impact, the outcomes, and the value that these solutions can ultimately bring. I would say specifically as it relates to internally developed solutions, the numbers are much smaller than that, just because of the time that it can take to stand up a new solution, especially if it requires regulatory approval. So if there's any FDA requirements, if it's clinical decision making or any of that, then the timelines become quite a bit longer. But for just everyday operational tools and things like that, we can typically get things out faster.
And can you give us an example of maybe a couple of successful pilots you've ran or ideas that have become real things out in the world?
Yeah, I would say in the last couple of years, probably our biggest success story in terms of a pilot that specifically has been a huge success and had a big impact among physicians has been our ambient documentation pilot with Nuance DAX. So it's the AI scribe tool that listens to the conversation between physicians and patient, or yeah, between physicians and their patients, and starts real time generating the note documentation during the visit. We did a pilot a couple years ago. We've expanded now to over 800 physicians across our organization who are all using the tool for over 50% of their visits. We're seeing on average, 15 plus hours a month saved in documenting time. And we can actually calculate that. We have access to that time information in our EMR. We're also seeing that physicians are giving that time back to their patients by adding visits and opening up access, which is such a challenge in the Chicago market. We have patients who are sometimes waiting months to be seen. And so the fact that they're able to open that time up and give it back to more visits is just huge to meet their community's needs. I would say that has been one of the biggest success, and physicians are just happier. They're spending less time doing that cumbersome documentation. We've had quotes from folks saying it's going to keep them in their job another decade longer, that they're able to go home and have dinner with their families. It's just all the great things that these tools are supposed to be able to do, we're actually seeing.
And can you remember who came with that idea?
I would say it was many physicians all at once.
Great.
I'm not sure any one person came forward with that idea. It was kind of a buzzy topic, and finally, um, the technology was far enough along that it was truly automated that we felt we could confidently get it out to folks safely.
Great, great. Any other examples you can remember?
I would say an internal idea is a solution that we call Aries. It is an AI, imaging AI solution that not just can scan X-rays and soon to be CTs and other imaging modalities, but can scan the image, not just identify findings, but actually generate the narrative documentation as well for a radiologist. So we're seeing substantial time savings there. It's helping with turnaround times. Again, just taking some of that time and administrative time spent off of these clinicians. All of this is happening with the physicians in the loop. Ultimately, with DAX, the note is reviewed and revised by the physician before it's signed off. With Aries, the tool that we created here internally with our data, our research and development team in conjunction with our radiology team, um, they are, queuing up that narrative documentation for a radiologist to ultimately refine and finalize. But the time savings is measurable and substantial, and something that I know our radiologists are really happy with.
So you've seen a lot of these ideas, and you've seen a lot of them come to fruition, and you've probably seen a lot of them crash on arrival. What do you think is the biggest red flag when someone comes to you with a great idea, or what are the biggest mistakes that you see founders make early on?
I would say we often find entrepreneurs have a solution that they go shopping for a problem for. We're finding this so often today with generative AI, now with AI agents. We know we have this capability, this technology. We're trying to go figure out where it can go. And we found that that's often hard for our industry, for clinicians and others to really respond to, because it's focused on the solution, not on the problem. And so a lot of what my team ends up doing is saying, let's shift that and help these entrepreneurs really understand what are the problems, what are the challenges, get them ruthlessly obsessed with the problems so that then they can better design the solutions, or match the solutions if it is really a technology that they think is out there that exists. So I would say that's one. And then two, ensuring that you can really tell the story of the impact, outcome, and value that the solution can bring in a quantifiable way. And so we are in a time when, especially health systems, but any healthcare organization is, you know, financially constrained, and it will be more so in the coming years. And so we need solutions that we can measure the impact, see the value. They're just going to get prioritized faster. And so really being able to quantify the outcomes and be able to measure and ensure that you're tackling the biggest problems is going to be a key to success.
There's a growing conversation, Callie, around whether clinicians make good entrepreneurs. From what you've seen, what unique strengths, maybe blind spots, do doctors bring to the table when they're trying to build something new? And, do you think clinicians make good entrepreneurs?
I very much think that they bring forward wonderful problems, great ideas. I think the transition from physician ideator to CEO of a company is a big leap in terms of skill sets, focus, and what your day-to-day job ends up being. And so I would say I've seen some positions who that transition isn't easy and they roll right into it. And I've seen some who, struggle because the CEO entrepreneur, requirements are much more seeking funding and business focused and less on the clinical side often. And again, that's just a very different focus. And so I don't know if I have a black and white answer of they make good entrepreneurs or not. I think it's just knowing your strengths and what you're genuinely interested in doing and being, and whether it's really the business side of running a company that you want to be more involved in, or if it is the clinical side. Because there are chief medical officer roles, there are clinical advisor, there are so many roles that if your passion is the clinical side, you can still be very much a driver and leader of an organization, but maybe leave this, CEO founder role to the MBAs out there and the folks that just love the business side.
So, academic medical centers like Northwestern often sit at this intersection of research, clinical care, commercialization. How do you see that role of academia evolving, when it comes to spinning out new ventures or even spinning startups into the system?
Yeah, it's such a good question. And what I'm not necessarily sure I have the best insight into kind of the role of academia. I think I have already found that there are so many wonderful changes that have happened just in the last 5 to 10 years, where, for example, now just with Northwestern University, our partner in education, with the Feinberg School of Medicine, there are so many courses and joint programs now that do combine, you know, the medical side of education with more of the business or even engineering side. We have a fellowship now of AI in cardiology, which is just so incredible that you're combining, the background and data that you need with the, you know, degree, the medical education as well from a cardiology perspective. And the folks that are coming out of that program are just the most brilliant people I've ever met. And it's amazing to see what they're now able to do in terms of applying AI every day to the work that they're doing to treat their patients. I'm seeing more and more programs that again combine, various aspects of entrepreneurship with medical degree programs. This is great, and I think it's only going to continue. I think where we're going to likely see more of that is the data side because AI is so dependent on data, just continuing incorporating data and these tools into those education curriculums is likely just something that's going to happen naturally and will be great because it ultimately is going to help everybody understand how does the future physician really leverage all of these tools and capabilities to do what they do to the best of their ability and leverage the tools to do it effectively and efficiently.
Yeah, I mean, that collaboration between universities and clinicians and industry, I think it's often talked about, but maybe harder to execute. And presumably, innovation hubs are a great kind of brewing ground for bringing all of those folks together.
Very much so. We have some deep collaborations with the university that we're kind of expanding upon to in the next couple of years with that exact focus in mind. Medical discovery, is so crucial to our industry and to what the world needs. And so how can we kind of work together to support that?
And are there any specific areas where you're actively looking right now for new ideas or partnerships, Callie, or is it always sort of left up to the pain points?
I would say in general, kind of our big theme areas are, automating sort of the everyday administrative tasks. So, we despite the many vendors out there, the many solutions out there that are applying automation, AI, and tools, there are still a lot of very manual habits. Healthcare in the United States has become so workaround focused because of the complexity of the players involved and the systems involved and the processes that have been set up for them to work together. And so many functions and steps and processes have been put in place that are just huge workarounds that are very manual, very people intense. And so we are continuing to look for anyone who's been able to kind of take some of those tasks and reduce the amount of burden and process that it takes. Areas like revenue cycle, prior authorizations, access, a lot of the areas where you're just combing through information to pull together the right information to get approvals. Um, I would say there are many companies out there that have done pieces and parts of it. Nobody's solved the full challenge yet. And so we're continuing to kind of look for how do we solve those complex areas. Um, I think the other areas are a bit more kind of again longer term medical discovery focus. So precision medicine and genomics. Um, the longer term diagnostic opportunities of how can all of these new AI tools and automations help parse through just the complexity of patient historic information to surface findings earlier, help diagnose earlier, get time to treat cut down, things like that. Another huge area, and that goes across a lot of areas like cardiology, oncology, a lot of the chronic care areas, endocrinology, and others, where we're just trying to get ahead of some of these diseases that are just causing a lot of burden on patients and a lot of challenges in the healthcare world in general.
It's interesting, Callie, because the first part of your answer there was all really about saving time or creating efficiencies, presumably within a system, which I suppose ultimately leads to, you know, less stress and more revenue, right? um, Great. So, we hear a lot about AI, of course. You've mentioned it a couple of times throughout our conversation. Where do you think the next big leap in healthcare innovation is going to come from?
I really do think it's that personalized and precision medicine. I'm a little strategic when I always start the conversation with the automation, efficiency, administrative, and then I dive into the medical discovery and diagnostic and things. And that's because we have to free up our clinicians of all this administrative burden in order then for them to then have time to then see more patients. If we're going to be leveraging these tools to bring in more patients earlier and sooner, like I mentioned, we already have, challenges. There is by far more demand, not just here in Chicago or just at Northwestern Medicine, but in general, we have more people who need care than individuals to provide that care. And so by freeing up all the work that they do all the time that just takes up time and doesn't require a medical degree to do, we can then free them up to be doing more of this care of individuals that we're finding. I think it also takes us on the journey that people still need to go on to accept AI. If you can get comfortable with it doing much less risky work, take care of that automation, help me with these low risk, painful points first, help me understand it, see it. And then as both the AI technology develops and my comfort with it, then we can start looking at much more, complex uses of it with diagnosing and, actually recommending care. I think it also helps us on the journey of the industry in general accepting AI. So I would say that's a little bit of the journey there. And then I would say in general, it's hard to get away from AI these days. I think a lot of what our team does is try to help understand what's real today versus ideas. There's so much buzz and energy around AI, but a lot of it is, it can take a test and pass it, better than a resident. Well, that doesn't mean it can actually start treating like a resident. It just can take a test well. And so, a lot of what we're doing is kind of myth busting and helping people understand, okay, well, what does that actually mean for what it can do today and where it can safely be used versus what is more of a 3 to 5 to 10 year horizon of the big wins or the big bets and things like that, and really trying to think through, okay, then how do we sequence our journey through AI to get to that future state and where it can be this big amazing thing in the future, but do it safely and bringing not just our workforce and our physicians along the way, but our patients. There's a lot of hesitancy there too. So how do we get them aware and familiar and providing input on what they're comfortable with?
So, before we wrap up, a quick lightning round. What's the biggest myth about innovation hubs, do you think?
That it's where all the innovation happens. I constantly say that we're an enabler for everybody else's ideas and innovation. So I'm just an organized group of folks who want to help bring everybody else's problems and solutions and ideas and challenges together. So we're a facilitator. We have the tools, we have the resources, but it's really the brilliant folks across our organization who are the ones who are speaking up with their problems or bringing forward ideas or willing to partner with outside creators to really do the innovating. We just come with organization, some tools, and some funding.
What's one thing you wish more clinicians knew?
I would say that we can start small. Again, I think a lot of people hear these big headline grabbing statements, and you kind of just instantly want to push back on these wildly crazy theories about some of the tools that are out there. And so it's, you know, work with us to start small. Try it somewhere that's less risky. Try something with just a couple patients, test it out first before kind of just blanket saying no. I think there's a lot of opportunity out there. Um, we want our clinicians to be better with the tools that are available, not, it's not a replacement of, it's just like we use calculators, just like we use a PACS now for imaging. There was a time when we used film and people thought we were crazy for getting rid of film and going to a digital image. And so this is a similar transition. And so figuring out how to make it fit into their world.
What's the best part of your job?
Seeing the impact that these tools can positively have on our communities, on our workforce, on just healthcare in general, because there's a lot that needs to be fixed.
Is there one book or podcast or two books or podcasts you'd recommend to innovators?
Um, I think there's like a predictable one, which is The Innovator's Dilemma by Clayton Christensen. It's a book that's been around for a while, but it still holds through about disruptive technologies emerging and just a good reminder of that. And then I have been listening to a couple different podcasts lately, as you can imagine, mostly about AI because I can't get away from it. But there's Everyday AI is a big one. That just quick sound bites on what are the headlines, what's out there, what are people doing, um, that is helping me think through, okay, what's real, what's not, where could it be, where isn't it?
Who inspires you outside of healthcare?
Hmm. Uh, I would say, in terms of someone who I think inspires a lot of people, Brene Brown. She's a writer, speaker. I saw her speak this spring in person for the first time outside of her books and other things. And she was just so relatable in terms of, how you can think about change and, how it impacts everyone every day and how we are in a world right now that is going through a lot of change, um, in a lot of different ways, positive and negative, and just how to manage that while you're also living your life and your job and everything else that comes with a day-to-day person. And so found it very inspirational.
If you could pick a superpower to solve a healthcare challenge, what would it be?
Uh, I would love to figure out how to just wipe out cancer in general, as a disease state across everything. So much goes into it. So many people have been lost. I feel like everyone's been touched by it in one way or another. And if we can just fundamentally figure out the cause and treatments and a way to just get ahead of it, I feel like we could shift to so many other things.
Great, Kelly, thank you. It's been incredibly helpful and eye-opening, I think, for anyone working in a hospital who thinks there has to be a better way. You've given us a real roadmap there. So thank you for your time
Well, thank
for us
you.
today.